I'm JP Cole.
And I'm Julie Cole.
And we are the co-owners of Cole Wellness, which is a wellness center located in Irmo, South Carolina. We have a unique multidisciplinary approach to treatment in which we incorporate psychotherapy, health coaching, personal training, and in the last few years, we've recently added massage therapy, chiropractic, and psychiatry as well.
Yep. And we're just welcoming you to our Build Your Best Life series on our Cole Wellness podcast. So thanks for being with us, and we look forward to offering you some really good content.
What's up, everybody? Welcome back to the Cole Wellness podcast, the Build Your Best Life. Well, we're actually not in the Build Your Best Life series anymore. We've moved on past that. Today, we are starting with interviews. Last week, Julie interviewed Mary Dell, and they had an awesome discussion about accountability. And this week, we have Dr. Darren Woodlief, a dear family friend of ours, is joining us to have a conversation. Dr. Woodlief completed his doctorate. Yes, hey. Completed his doctorate in clinical community psychology at the University of South Carolina. He's in private practice in Columbia, primarily conducting assessments related to mental health concerns, learning disorders, autism, and neuropsychological functioning. He's also a former adjunct professor and researcher in the Department of Psychology at the University of South Carolina. He lives in Irmo, whoop, whoop, with his wife, Katie, and son, Emerson, and plays music as often as possible in his free time. Sometimes with me, should be more with me, but I don't practice enough. What's up, Darren?
Hey, thanks for having me.
When we very first even discussed possibly having interviews with people, you were one of the first people that comes to mind because not only are you super cool, but you're a highly intelligent grounding factor in our lives. And so I just appreciate you as a friend and as a colleague. And so I look forward to talking with you today about whatever we're going to talk about.
Right back at you. I appreciate it. I've been listening to your series and lots of good stuff. And, we've been kind of sharing informal feedback, or I've shared some informal feedback about some of the stuff you talked about because I really believe in a lot of it and agree with almost all of it. Was awesome. Constantly, especially listening, hoping to hear my name in there. So this is like a dream come true, really.
Enough about me. What do you think about me? I think that's awesome. So thank you for taking time out of your week. We're in full-on quarantine status, so we decided to honor that. Sadly, you and I haven't seen each other face-to-face in a couple weeks now because we've both been trying to honor that for our families and for our work. And so I'm at a quarantined office. And you're at your office, I think. So generally we start off with a piece of gratitude, and today we kind of discussed a little bit about how nice it is, as much as this doesn't feel normal, being able to have a little bit of interaction and some laughter, even through Zoom, is actually really helpful, especially after days on end with not really seeing too many people.
Absolutely. I think it's this is becoming the new norm for, social interactions right now, and being able to reach out to people and try to help people, whether professionally or just, on friendship level. So I'm grateful for it. Yeah,
for sure. I know that we've had a couple of different meetings and different things like that on Zoom that actually some of them have turned out surprisingly well. It's kind of cool to interact with people from all over the country that I generally wouldn't get to interact with socially. Mm-hmm. So it's just an odd time, and I think normal is changing. So I'm grateful for this opportunity to connect in this way. And if you're watching this and you haven't experimented with Zoom, then I strongly encourage you to do that, or WhatsApp. Julie and Mary Dell talked about Marco Polo is another one. But there's different interfaces that we can use to stay socially interactive that don't include us being physically together. Now, if I can just figure out how we can play music together like this.
I've been navigating that with some of the folks that I play with, and there's definitely no live solution that you can in real time interact. But we've definitely done some, recording of something and then send a video and then kind of play along with that.
Yeah.
Which I guess is the next best thing, at this point. So. Yeah.
Well, we will have to experiment with that. I think in 2007, I committed to writing a song with you, and it's 2020. And what better time than a quarantine to do that, right?
Just get under that 13-year wire.
Yeah. Awesome. Yeah. So tell me a little bit about kind of your thoughts about what you wanted to discuss a little bit about today.
Right. So, well, we talked about kind of how I got to where I am. As you mentioned, I do assessments, a lot of different kinds, mostly kids, but I'd say maybe 75% kids, some with mental health issues, some with, ADHD and seemingly no other difficulties, some with, a broad spectrum of difficulties, past traumas, learning disorders, things like that. And also a lot of adults, people that come in their 20s and 30s and think, maybe I have ADHD, or my kid got tested and all the things that they checked off was, I had all those things.
I can relate to that. Yeah.
That kind of stuff. Some neuropsychological stuff that's not really my expertise, but we do kind of a screening, for people that are, suspect maybe they have a injury or they suspect that they might be in some neurological difficulties. We'll get referrals to do testing for that kind of stuff. And this is absolutely, I had, no intention of doing this when I grew up,
Yeah.
was not, or even when I was in grad school, I didn't expect to be doing this. Each step of the way, I've kind of just like followed, what seemed to be the next right path,
Yeah.
and kind of got to here, kind of stumbled into that, I didn't finish my PhD till I was 41. So
Yeah.
it surprised me as much as anybody.
Yeah. Yeah. I remember when you were talking about going back to school, like one of the questions that comes to mind for me is like, so we know that this has been a journey, but like when you were say 14, what did you imagine at that time in your life you wanted to be, and how did that change over time?
Well, when I was in high school, I was a very unmotivated student who did just enough to get by. In my mind, I thought, well, I want to be a doctor.
Yeah.
As my son would say, like a real doctor. But really, I think that was just based on, that's the people that make the most money. So that's kind of what I want to do.
Yeah.
I really, I don't know, I was pretty unfocused. And I guess that's part of the story was, is that I was one of those kids that never got tested when I was younger, but I clearly, in hindsight, was experiencing all the textbook ADHD kind of things. But, the blessing curse was I was smart enough to get by and to make pretty good grades, with a lot of support. I had great parents who were very supportive, and they helped me get through school, maybe helped me too much, making sure that I turned in homework assignments and studied for tests and got things done. And as long as the grades were good, it wasn't a big problem, which works great until you get to college and then nobody's doing that anymore.
Yeah. Yep. So you got to college, and what was your original major?
My original major was electrical engineering. Again, because I looked at the list of starting salaries. It was like chemical engineering, electrical engineering. Chemical engineering didn't that sounded really, I didn't like chemistry, but physics was, I did like physics. It was interesting.
Yeah.
So, and I ended up going to USC. I had a, full scholarship, Monmouth College, the whole thing.
Yeah.
Largely, my mom probably deserved at least 65% of that credit, for like making sure that I got in my applications for all the scholarships and schools and everything. So it was really just a random thing. I really didn't have any idea what I wanted to do.
Yeah.
I did engineering for a while, and then that kind of got hard. And I think I switched to English after that, maybe, and then I forget. I had like 7 different majors the first time I was in school. But then basically what happened in each one is as soon as it got hard, I didn't have any study skills. I had these ADHD issues that I didn't understand. I kind of just thought of myself as lazy and, like I said, unmotivated. I didn't know how to organize like work. I didn't know how to take a big project and break it down into parts and say, okay, I need to finish this part first and then this part. It was more like I just put things off, and the night before I'd stay up all night, just throw it together and not do very well, And I just thought that I just thought that I was, even though I knew I was smart, I just thought that I'm just not good at these things. Like there's just some kind of deficit there. I'm lazy, whatever. Then I guess after my sophomore year, the relationship that I've been in for several years ended, and I wasn't doing that great in school, and it just kind of that's what kind of led me down the road of partying like a lot. And I went from like in a year's time, I went from like Dean's List, honors college, almost all A's to beginning a semester that I stopped going to class halfway through, was, partying literally every day, all day as much as possible. And then I got kicked out of school.
Yeah.
So within 2 years, I went from honors college, all that, National Merit Scholar, to being expelled from the university for a semester.
Yeah.
And I messed around for a little bit, tried to get back into it. Again, having no clue what was going on or why all this was happening.
Yeah.
I'm getting kicked out again for 2 years. And at that point, the drug use, drinking stuff was pretty out of control. I just had that thing where, especially with, to be specific, marijuana was like this thing where could literally get nothing done with that. Like when I would do that, and the only thing that happened, the only positive thing during that time was I got good at guitar, because I would literally do that for like 13, 14 hours a day, but nothing else could get done. No schoolwork, like jobs, all that kind of stuff.
Yeah.
Which fortunately ended up with me finally going to my folks at some point and asking for help. And they said, okay, that was asking them for help not for help with the drugs or anything, but with money.
Yeah. Let me clarify what kind of help I want.
Right. And so fortunately that time their answer was yes, but you got to get some help for this, which led to me going to outpatient treatment and I got clean then. I didn't stay clean, there was like a little period there.
Yeah.
In 1999, at the end of 1999, I finally did get clean, and have been clean since. 20 years this past November. So
yeah. How do you feel like marijuana played a role with your ADHD at that time? Like, did you feel that it helped?
At first, yeah. And maybe so. At that point, it had. Oops. At that point, it had ballooned into not just ADHD, but I'm dealing with all these life stressors. I've been kicked out of school. I got nothing going on, so I'm depressed. I'm anxious. I don't understand what's going on. So really, it's like, so the ADHD kind of led to the failures, which led to the anxiety, the depression, which led to the drug use.
Yeah.
I think I was really medicating this. I was trying to escape the reality that I found myself in.
Yeah. Yeah.
I didn't understand why that had happened or how it gotten there, but I wanted to not feel that way anymore. So that's what it was, more so. And ADHD, I think the contributor there is just the impulsivity of just, dumb decisions of like, oh yeah, it's a good idea to just not go to class today, because guess what? You get that instant dopamine hit of, oh, I feel much better, not because I'm not going, and you keep doing that, and then you got to quit. And then you get an F, and then they kick you out.
I'm very familiar with this process.
Right. So yeah, but it was definitely a self-medication, these undiagnosed issues that were going on.
Yeah, for real. I totally get that. So then once you got clean and you started going back to school, what got you into psychology at that point? What'd you do then?
So I got clean. My folks were like, you can live here, but you got to get a job. So I got a job, which was at that point was on a survey crew.
Mm-hmm.
And I had told them I had experience with AutoCAD. So I was doing a little bit of drafting, because I'd taken that one class at USC when I was still in electrical engineering.
Yeah.
So I got a job there and actually held a job for a while. Imagine that, I'm clean and I can actually go to work every day.
Show up.
Things like that. I think actually I initially went back to school for music, because I've always loved music, but quickly realized, and I was actually for a while trying to transition into making a living in music, playing music, teaching guitar. But I quickly realized, that I hate teaching guitar, which is a problem if you're going to be a guitar teacher.
Yeah.
And B, attaching my living and bills to music sucked all the joy out of it for me. You
Yep.
know, so it took this thing that I love doing that's like an escape, a release. It's like, and also a way of like connecting with people, you know, and made
Yeah.
it awful. Like I found myself before gigs thinking like, oh shit, I got to go play this gig, you know, and just like, wait, what? Yeah.
Yeah.
How does that happen? So I tried music for a while. That didn't work out. And honestly, at that point, it was like, well, what's the quickest degree I could get?
Yeah.
Because I got to get done with school. And I think maybe I thought, well, maybe, you know, like many people in early recovery do, maybe I'll be a treatment counselor just because I really still had no idea what to
Yeah.
do. And school was still a struggle for me. I mean, like I did okay, but I did better because I wasn't, you know, getting high and stuff, but I still had lots of trouble with task management and turning things in on time, paying
Yeah.
attention in class, just all the usual stuff. But again, was just chalking it up to like, I'm just lazy or I'm just whatever, you know, kind of thing. So then I managed to finish in psychology, but then just kept working in that same field in civil engineering because at that point I got a decent job as a drafter. Somewhere in there, my son is born, you know, so it's like even though I didn't really like the job and I was kind of bored to death, it was like I likened it at the time as you know, some drafting is really creative and there's a lot of different things you can do with it, but not what I was doing. It was like an assembly line, like put this here, move it there, put this here, move it there, you know, kind of thing. And it was not great, but I felt kind of trapped because I got this new kid and the money's good, bought a house, et cetera, et cetera.
Yep.
And then God, the universe, whatever, gave me a big old kick to the ass with the whole housing thing.
Yep.
You know, because civil engineering, bottom falls out, I get kicked out, you know, laid off.
Yeah.
And so then I was like, well, crap, what do I do now? And then so this guy Patrick, who you know, I went to high school with, and had met him in the first like 12-step meeting that I went to after I got clean, or when I was trying to get clean, and I kind of connected with him, and he was still living with his parents at that point, and they kind of like brought like semi-adopted me, you know, like I go over there on Sundays and hang out and watch football, and his mom would cook dinner.
Yeah.
And I kind of connected with his father. So this would have been back in like 98, 99, 2000.
Yeah.
So then fast forward when I'm laid off and trying to figure out what to do. This is like 2007, I think.
Yeah. Okay.
2008. And so his father was a professor emeritus, or is a professor emeritus at USC. He doesn't work here anymore, but I guess it's like a thing. And now he's a dean of a graduate school down in Florida. You know, gave me some really good guidance and advice. And I was kind of thinking statistics because I'm, you know, really good with math and that kind of thing. And there's lots of kind of research avenues there.
Yeah.
But he kind of guided me into psychology, and I managed to connect with this fella at USC. I sent an email to this one person. She sent it to 3 people, and one of those people called me and was like, these things you're talking about, you know, connecting, you know, the effects of drug use and things like that with statistics and studying and trying to help people with that. Like, that's exactly what I'm doing.
Oh, wow.
And he hired me to work for him for a year and then help me get into grad school.
Wow.
So it was just like literally just a series of, you know, because I knew this person and they gave me guidance, and then this person instead of just deleting the email, this other person said, well, I'll send it to these people because I think they might know something in that area. And then, you know, managed to connect with this person who really, I guess, just understood because I had written this letter that kind of talked about my experiences and why I wanted to study these things, or why I thought they were important.
Yeah.
He saw something he identified with in that letter. And he was, you know, between him and Dr. Pelliser, those are the folks that helped me get into grad school, you know, in the first place.
Yeah.
Again, I still had no idea I was going to do what I'm doing now. I thought I was going to do what he did, you know, which is research, teach at college, things like that.
Yeah.
But much like guitar, it turns out I don't really like teaching that much either. I did like the research side of it. Yeah. But not so much the teaching, you know.
Yeah.
But then when I did my postdoc, I did part of my postdoc here at Comprehensive Psychological Services, where I work now. And I realized that what we're doing here is another way to serve those same people, you know.
Yeah.
Not necessarily so much, you know, related to drug use, because we do, of course, see people here that have some issues in that area, but that's not where people come. People don't come here for evaluations of that kind
Yeah.
generally. But I do see a lot of folks, a lot of kids who were where I was at 8 or 14 or 28.
Yeah.
Because I guess the part of the story I missed was in grad school, one of the other clinical advisors I was writing reports for her, and she was noticing some errors that I made and things like that. And she asked me, she says, have you ever thought you might have ADHD? And I'm like, what? It's crazy because, of course, I'd studied about ADHD and read about it, but somehow I never made that connection, But when she said that, and it like gave me a fresh look at it, and I was like, holy shit, you're right. Like, and then like be able to turn around and look back through my timeline, and just like everything kind of fell into place. Like, that's why in elementary school, when they had pods of desks of kids, they'd have 6 kids here, 6 kids here.
Yeah.
And then I'd be by myself with the teacher.
Yeah.
Because I was distracting all the other kids,
That's why that happened. Yeah.
That's why my test grades would be, 98, and my homework grades would be 0.
Yeah.
I would not do it, or I'd do it, forget to turn it in. I mean, all the literally the textbook things,
Yeah.
But
it kind of pieced all that together for you.
Right. And it helped me understand kind of what had happened, how I got there, And, it's, you spend a little bit of time with what if and why didn't or whatever, but that's, what matters is like, now I'm in a position to help the people that are in that thing, because, like they did for me, these things snowball.
Yeah.
And they're often mistaken for each other,
Yeah.
If you don't identify, I think that's one of the themes that we talked about earlier, is that if you don't identify what the problem, and this goes along with what you guys have been talking about, if you don't identify what the problem actually is, you can't fix it. You can't address it.
There is no solution if you don't know what the problem is. Yeah.
Right. And that's what I feel like I'm able to help with here,
Awesome.
Because I see a ton of people that come in for ADHD, and I'd say, I don't know, maybe I should track this kind of thing just to see that, to scratch my stats itch. But, I'd say, maybe a half or less actually have ADHD, more often it's PTSD or anxiety or depression, which, guess what's in the criteria for those disorders? Restlessness, trouble concentrating.
Yeah.
So if you're having severe trauma, of course, you're not going to be able to sit in a classroom with people and concentrate. Of course, you're not going to be able to sit and study, if you're incredibly depressed. You're not going to be able to think sharply if you're depressed. Now, having those things doesn't mean you don't also have ADHD, but, certainly you can't tell if somebody did if they have profound depression or if they have PTSD, because those issues are so prominent and so impairing. And sometimes, it's like a light bulb goes off for them, like, oh, wow, I guess I need to address this thing,
Yeah.
But that's what got them here. That's what got them to seek help, was having that issue and think, well, maybe it's ADHD.
Yeah.
Well, no, it's actually all these other 3 things. But guess what? Those things can be improved, and those things can get better.
Yeah. So that's something that you and I have talked about a lot, which is the importance of assessment and doing exactly what you do, so that you can tease out what, we see these symptoms, but being able to figure out exactly what it is, because once we do, there are effective treatments for it. And so it can give hope and understanding. Like, I really appreciate your honesty with the fact that you've had this story where it's, as an adult in long-term recovery, that the light bulb comes on, and like, oh, this is a piece that was missing for me that explains a lot of this stuff. Mm-hmm. So looking back on that, like, what interventions, what things do you feel like help those versions of that remind you of yourself, even at 8, 14, 18 years old? What do you see as a helpful tool for people dealing with that?
Well, so speaking strictly for ADHD, because of course, anxiety or other things can really complicate the picture. But, really looking back on my timeline, I don't think I experienced, notable depression or anxiety until college, when I crashed and burned.
Yeah.
There was some anxiety, but more of a social kind of anxiety, like a nervousness about how people perceive me or things like that. So for somebody that's more of a strictly kind of ADHD thing, well, let me bow back up a second and say, I became a psychologist for a reason, not a psychiatrist, because I believe in treatment and therapy. I believe in, whenever possible, to try to address things without medication if you can.
If possible,
that's
yeah.
why I went down this path instead of the other path.
Yeah.
My wife is essentially a psychologist. She's a nurse practitioner practicing in psychiatry. And I believe in what she does as well, and she's very good at it, and she's very thorough.
Yeah.
But coming out of recovery, I think I even had maybe a bias against medication.
Yeah.
Not to get into what fellowships say or people say, but we'll say that there are people in the recovery community that present a very negative opinion about medication,
Yeah.
and I think that's very harmful.
Yeah.
Because there are dangers, of course, and there are problems with that, of course, but there are also a lot of dangers and problems that come from people not getting medications that they need because they feel like it's, there's a stigma around it. So anyway, and so I had this kind of bias against it, honestly, and even going through grad school, I kind of felt that way. But ADHD is one of those unique things where it turns out that in the literature, medication is the most effective treatment.
Yeah.
It just is.
Yeah.
And not saying that everybody should do that and everybody doesn't necessarily need to do that. But if you're just talking about what treatments are going to give the best effect, it's medication. Now,
so far that we found.
What's that?
So far that we found, right? That's just the truth.
Yeah. I mean, maybe there's something better. And there's a slight differential for medication and therapy. Like that is the best. That's the A treatment is the combination of both.
Yeah.
But if you look at that, there's that, and then there's just medication, and unfortunately, just treatment is a good bit below that.
Yeah.
And now that is, that's not necessarily across the board because there's different kinds of ADHD, right?
Yeah.
And it can change over a lifetime. Like when I was a kid, I probably could have met criteria for hyperactive impulsive, because I was all over the place. Couldn't stay in my seat, couldn't stop myself from blurting out, never raise my hand before I talk, all that stuff. I don't think many people call me hyperactive now.
Yeah.
What's that?
Kind of like one of our friends that won't be named.
Right. But I don't think many people call me hyperactive now.
Yeah.
So now I'm more on the inattentive side. So anyway, so there's a lot of things that people with ADHD have problems with that you can learn your way around, that you can you can do things to improve. But if you have a kid that's so hyper that they can't sit still, then it's going to be difficult to teach them any of those methods.
Yeah.
So for some kids, the path is to use the medication to then help them get to a place where they can try to behaviorally improve some of these areas.
Makes sense.
Yeah. And for adults too, that could be a way, and half the kids that have it when they're 10, 11 years old are not going to have it when they're adults.
Yeah.
So you don't have to think of medication as necessarily a lifetime thing either if you do choose to go that way.
Yeah.
Yeah. So, but phones, these things are great and a curse, there can be a lot of positive things about them, a lot of negative things that can be distracting and all that kind of thing. But they can also, the fact that I have a Google Calendar that sends me an alert when I'm supposed to do something or be somewhere saves my life because I don't remember. That's part of it, is just I'm not good with remembering that I need to do this or do that. And if it's not in my calendar, it's not happening. Yeah. So there are a lot of tools that you can use with your phone to help you kind of manage things, manage tasks. There's people who come up with different apps, productivity apps you can use where you set a timer and you work for 30 minutes and then you take a 5-minute break kind of thing. So there's lots of great technology there. Yeah. That people can use. ADHD is not one of those things that traditional therapy I think is super useful for. Now, if you also have depression or if you also have anxiety, then sure, a more traditional therapy setting can be good. Just attention span wise, a lot of, 50 minutes a week for once a week, it's like that might be helpful for a day. Yeah. But really, 6 days later, is that really having an effect? Maybe not, so there are some people that are doing a more non-traditional kind of approach, an ADHD coaching,
Yeah.
or ADHD approach where it's more of a daily check-in kind of thing, a shorter, like 5-10 minutes a day kind of thing, which I think for ADHD is probably a more effective, because then you're kind of helping them like on a daily basis to say, okay, today I need to do this, and you kind of helping to
Yeah.
kind of bridging those gaps in their abilities and helping them. They call it scaffolding. Like
Yeah.
you're building these supports that you then want to pull out of the way, and then there's something built there that stays.
That makes a lot of
Is
sense.
remembering that I can manage these things best if I write them down in the morning, and then I look at them, and then I look at them again at night,
Yeah.
and people need help to get that going, but then eventually they can get it.
Yeah. Well, and that piggybacks off of what Julie was talking about last week with, that principle of accountability. And you and I have talked about this a good bit. I've loved the idea of that coaching mentality for people with ADHD, that daily touch point, and getting away from kind of traditionally what the insurance companies say you need to do with a client, and being able to get creative about what's going to effectively help this individual the best.
Right.
And, I do have some clients that are dealing with co-occurring stuff, and ADHD might be one of them, but I've found for sure that more regular, shorter duration check-ins, it's like, if what we know about the average attention span is it's about 20 minutes or whatever, like,
Right.
Why are our classes 3 hours long? And then
Right.
So I think that's really cool. What would you say is the most impactful thing being now that you're conscious of it, being an adult in long-term recovery? Like, what's one of the, you mentioned the Google Calendar, but what are other helpful things for you in your own personal life?
So the Google Calendar, those tools of technology are great. Really, accountability is a big one. Having people in my life that are aware of the things that I'm doing and would, notice if I stopped doing them, has been a huge. I mean, that's really the way that I've been able to make a lot of the changes I made. Whether it's wanting to exercise more regularly, which may not have a direct impact on ADHD, but anything that improves your overall health is going to be helpful.
Yeah, for sure.
Whether it's that or whether it's my wife saying, hey, when you finish eating, you can put those dishes away. Just something, to give myself credit. I usually do that now.
Yeah.
But it's not something that I learn to do growing up. It's not something that, those things don't come naturally to me to like put something away when I'm done using it.
Yeah.
I'm, just more like walk away and deal with it later kind of thing, So just those little things. And, the fact that she has, that we've talked about these things, she's well aware of the way that my ADHD manifests, and she's able to, of course it's annoying to her, but she's able to say, hey, I noticed that you kind of started doing this again, that's not the most awesome thing you could do.
Yeah.
So having people in my life that are willing to say, hey, what's going on with this?
Yeah.
Is super helpful.
Yeah.
Yeah.
Well, and we've talked about how important of a useful tool that is for people in recovery, and how that transitions over to so many areas of our life, to have trustworthy people in our lives that we do give that spiritual permission to give us that constructive feedback,
Right.
That's one of the grateful things I'm appreciative about our professional and personal relationship is having that ability to get feedback constructively from one another. And so that's really cool. I appreciate that.
One of the drawbacks of being, a kind of nice person that most people kind of, at least don't hate, is that people don't often uninvitedly tell you things that you're doing that are annoying or that kind of thing, So, I got to have people that are willing to say things to me I don't want to hear. And it's nice that it's not because I'm an asshole and they want to make me angry. It's because they care about me and they want to see me, succeed.
Yeah.
But I gotta have that because obviously another piece of ADHD is that, the kind of thoughts can kind of bounce all over the place and ideas and things. And so giving attention to myself and what's actually going on sometimes is something that might fall by the wayside, to have somebody say, hey, what are you doing with this, you know, and I think, oh, well, yeah, of course. It's so obvious when they point it out, but I can't see it myself a lot of
Yeah.
times. So I got to have that.
Totally get that. Yeah. So I really appreciate you getting on here and talking about all this. I didn't know where today was going to go. Is there anything that's come up that I know what I wanted to ask. So a lot of the people that listen are, you know, adults, some of them with kids. You and I've talked a lot about the importance of getting proper testing. So if somebody's listening to this and they're concerned about their loved one, whether it's an adult or a child potentially dealing with ADHD,
right?
What should you do?
So, you know, there's of course there's some cases of ADHD where, you know, kids are taken to the doctor and they get information from the teachers at school, and, you know, the kid can't sit still in the appointment long enough to even talk to the doctor. And it's like that all the time. And it's pretty obvious that's what's going on. And I think that it's not an unreasonable thing in those cases for people just to try some treatment and see what happens, you know. But like I said, because it can look like so many other things, you know, like why, like, okay, someone's not paying attention, but why? Is it because they have this thing in the prefrontal cortex that makes them, you know, have difficulty focusing attention?
Yeah.
Or is it because they're depressed, or is there some trauma that happened? So I think that's where the testing becomes super important, because you can differentiate, you know, to a degree, or at least identify other factors that may be contributing to it.
Yeah.
You know, because these, you know, as effective as these treatments are, it's no small thing to make that decision to give somebody a stimulant or a non-stimulant medication. And I don't think I'd ever want to do that without having some proper testing first, you know, to make sure that that's really what's going on. Because if someone's anxious and that's why they're having that issue, guess what's going to happen when you take a stimulant? You're going to get more anxious, and it's going to get worse.
Yeah. So it's really important to tease out exactly what it is. And that's really only accomplished not just through a brief conversation with a physician, but really can be done with more thorough testing with somebody like yourself, right?
Right. You know, so we're going to collect information from the parent. We're going to have the parent complete surveys that are normed against, you know, other parents. We're going to have the kids, if they're old enough, do their own surveys. We're going to have them do cognitive testing and computer tests that kind of measure those things, you know, objectively, you know, so we can get a clear picture of what's going on, you know, find out what's going on with school, what's happening there, what's happening at home. You know, if somebody's only having these issues in one setting, that's not ADHD. There's something else going on. So we have, you know, there's a lot of people dismiss ADHD because they say, oh, well, it's over prescribed, and people use that to control their kids and blah, blah, blah. Well, you know, first of all, maybe it is overprescribed. That, you know, that may be the case, but there's also a lot of people that could use medication that aren't getting it.
Yeah.
You know, so
both of those things can be true.
Right.
Yeah.
So, you know, if you think it's overprescribed, if you think it's overdiagnosed, you know, okay, you're right. So, like, come have an actual testing done. Don't just you know, don't just decide we're going to try medication because things are going like this. You know, like, you need to get a proper diagnosis first before you jump off that and start giving somebody medication like that. It's pretty powerful.
Awesome. So how would a family get in touch with like a facility like yours?
So, you know, we get a lot of folks that are referred from the family doctors. You know, they went to the doctor and the doctor basically said what I just said, like, okay, it sounds like that, but let's get testing to make sure. You know, of course, people call our office directly all the time because they search on Google and see that, you know, that's basically all I do is that kind of testing, you know, not just ADHD, but just in general.
Yeah.
We'll get people that just call from Google and say, hey, you know, I think this is going on, you know, and our, the people that answer the phone, you know, they understand these things, are able to ask the right questions to figure out what kind of testing needs to be done, you know, or if there's a question, they'll bring us in on that part of it. But so it kind of happens both ways. Sometimes we get referrals. Sometimes a private school say this person's kid needs testing, or somebody's work or somebody's wife, you know, is like, you need to go get tested. But basically people can just call, most insurance plans cover this kind of stuff.
Yeah.
Especially if it's causing impairment at school, impairment at work, those kind of things.
Yeah.
So.
Cool. Awesome. And your practice name again?
It's Comprehensive Psychological Services.
Cool.
Yeah, and we're not on social media at this point, but we do have a website.
Yeah.
And a phone.
And a phone. Smoke signals work. Yeah.
Yes.
Yeah.
And I'm on Psychology Today, and those you can check out my page on there.
I will.
Thank you.
Yeah. Awesome. Well, dude, I really appreciate your time today. And I hope you have an excellent rest of the week.
Appreciate it.
I'm trying to think what else. For those of y'all listening, thank you so much for checking this out. And you can follow us at colewellness.com or all forms of social media. I'm going to create a blog post about this and probably have you proofread it.
All right.
And I just really appreciate your candor and talking about your own experience, both personally and professionally. And I think it'll be useful to a lot of the people that we share this content with. So thank you.
I hope so. Thanks for having me.
Yeah, man. Have a good rest of the day.
Yeah, you too.
All right. Peace.